You're welcome back. This is Sunday Breakfast on ChannelOne TV. Just gone by, gospel artist extraordinaire. She sounds like how she sings, if you realize that. Yeah, she had a very nice voice, very soothing voice. Sonia Bieko, and that discussion with Jude. We are still in the month of October, and it's Pinktober, Breast Cancer Awareness Month, and we're encouraging all of you to get tested, male or female, especially the males, because they feel like they are part of the 0.00005%.
Especially all of us.
Who get?
Especially all of us.
Especially males.
Especially all of us.
Jude, can I finish?
Yeah, you can.
Thank you very much.
You're welcome.
So as it is Pinktober, we're going to be discussing, you know, symptoms, signs of breast cancer, and joining us on this discussion is our very own, now we can say our very own, Dr. Oum-Kalsoum Adams.
She's a co-host.
I know, right?
She's a co-host.
Our third leg.
Incredible.
Dr. Adam, hi, how are you?
Hello.
Looking all pinkish.
Yeah.
You know, Pinktober.
October.
I know you're looking for your pins join
Right,
the movement.
So I know
I like that.
There's actually pink in my jacket, so
Yes, there
I'm
is.
not out of order at all. I'm fully fat.
Of course.
You know my only concern with the breast cancer conversation when it comes to pride. I told you already this morning. The way
they do their
the way they
thing.
do that thing is some way.
They're doing their
Some
job.
of them they do the thing like they have some hidden agenda we don't know.
It's all up here.
Are you sure?
It's all up
I
here.
know
It's
what
all
I'm
up in your
I know what
mind.
I'm talking about.
It's all up in your mind. You're overthinking it. I
I hope
promise you.
so, honestly. I really hope
You're
so.
overthinking it.
I hope so.
You're overthinking it. So today we're delving more into breast cancer, Doc. What is breast cancer?
Okay, so breast cancer is, so we know that the breasts is on the anterior chest wall. And if you have cells or the epithelial cells within the breast undergoing certain mutations at the very cellular level, and then now they begin to divide. I'm sure I've spoken about cancer on this show for a very long time.
Yeah.
Now it's
Yeah.
normal for all of us. So it begins to divide, and then it divides in such a way that it becomes uncontrollable. And then in no time, it starts to spread to other areas. So once you have that setting happening, then we see that you have breast cancer. But it has to be confirmed by doing a histopathology, usually. You get it? So yes, breast cancer is when you have the cells within the breast dividing uncontrollably and then leading to a malignancy. And most of the time, it tends to spread to other parts of the body, giving you various signs and symptoms, depending on where it has spread to. And it's important that we know that breast cancer globally, according to GlobalCan 2020, is actually the leading or the commonest female cancers in the world, accounting for about 31.8%. And globally, again, it is the 5th leading cancer deaths in females. Okay, but when you come locally to Ghana, and still according to GlobalCan 2020, it is actually either the first or the second leading cause of death in women from cancer. And this is as a result of the fact that the research showed that about 95% of either low or middle income countries have breast cancer being either the first or the second cause of deaths in their women. And out of that...
Serious?
Yes, out of that. So you can imagine, if you're looking at 95% and out of that 80% is within the low and middle income countries, and we know Ghana is one of such. So you can imagine, exactly. And then also about in 2020, again, this is statistics from 2020, we have about 4,645 new cases being diagnosed yearly. So you can see it's quite a lot, which is accounting for about 20.1% of all cases. And out of that, almost 50% end up in mortality cases, that is deaths.
Wow.
Basically because of the late presentation.
The numbers are staggering.
Yeah. basically because of the late presentations.
Wow.
So it is actually a very important disease that needs to be talked about, and that's why I'm very happy, and we are all repping our pink to show that we are part of the advocacy. You know, yes, because it's important. Our women are important. And it doesn't only affect women, it also has, even though little percentage affects men as well. And so this can bring us to the risk factors associated with getting breast cancer. So some of the risk factors are, in fact, the two most important risk factors is the fact that you are female, your sex, okay, and then your age.
It's such a broad risk factor that you need to pay attention to.
Exactly.
There's almost nothing you can do but just to know about it, right?
And so
that's
once
why,
you are female, even though we have some percentage that goes to males, and those are usually from families who already have a family history and all of that, exactly. But then once you are female, and then once you are also aging, most of the time we say that 40% or about majority of people when they are 40 years and above, they have the risk of developing breast cancer. But even that, if you look at certain studies that have been done locally here in Ghana, one of such, which is by Boama et al., it showed that approximately about 30% of the breast cancers are actually happening in ladies who are 35 years and below. So you can imagine.
What percentage again, sorry?
About 30%.
About 30%?
Yeah.
The age has lowered.
Yes. So it's actually, the trends are changing.
Right.
You get it? So not only the fact that we say, oh, breast cancer, anything cancer, it's somebody who is elderly. No. It's even affecting people who are younger.
For with breast cancer?
With breast cancer.
Signs and symptoms?
Okay. So signs and symptoms are things you would see. So first of all, a lump. If you see any painless lump within the breast. Painless lump within the breast, it should predispose you, or it's something that you need to investigate. Okay. But most of the time, what we say is that even with the breast examination, you first need to see. You first need to look. So first of all, women, it's important that at least every, maybe about 7 days after your usual menstrual flow, you do your own breast examination at home. So what at all should you look out for? What you should look out for is, at least you should have, once you've exposed the breast, you stand in front of the mirror and then you look. So what are you looking for? You are looking for, are there any abnormal skin changes around the breast? Does one look bigger than the other? Are there any differences in the shapes? So even shape changes could be a sign, an early sign for you to quickly seek medical help. Okay, so you look. And then for our ladies who have little more bigger breasts, you don't only look at the outside, but you need to lift the breast and also look beneath it. So when you look beneath it, sometimes there may be some ulcers, there may be some skin changes. Sometimes you may even have this, you know how what's the name? Orange peel looks like. Yes. So when there is edema or swelling of the breast, it looks like orange peel. So we call it peau d'orange. You get it? So something like that. You look first. You look very well. And then you are supposed to also try and then put your hands around your waist. When you put your hands around your waist, then you press on it. When you press on it, the muscle that the breast sits on will be contracted.
Okay.
So once it's contracted, you notice that sometimes some of these lumps and things now become more obvious for you to see. You get it? As opposed to you just looking and not seeing anything. And then when you are looking, you also look at the directions of your nipples. Most of the time it's supposed to point outwards. There are people who have, because of the lumps that are in there, it may have caused an inversion of the nipples. So the nipples will tend to face inward instead of outward. You get it? So just by looking, you can actually see a lot from it. Then the other thing is that you would want to use your palms to examine. Once you start, so you use your 3 middle fingers, and then you use the parts of the 3 middle fingers. You know, it's interesting because some people come and tell you, the whole breast is lumpy. I can't tell what is a lump from, normal breast tissue. Yeah. So it has to do with how you do it. So you're supposed to press the breast tissue against the hard chest wall. Because if you hold it like this, everything will be a lump. Everybody will be rushing to the hospital that I have something. You get it. So you're supposed to press against the chest wall. And there are various ways by doing that. The simplest way is to divide the breast into 4. So into 4 means that you have 2 upper quadrants, left and right, and then 2 lower quadrants, left and right. And then you examine, so you are going to press the breast tissue against the hard chest wall. And then once you do that, if you feel any abnormal lump, then you know that maybe there's something happening and I need to quickly check it out.
Let's advertise let's mention the number again so our viewers can know what's happening. So I'm sure a lot of you have messages you want to share, you want something bothering your mind, a question, a contribution, an experience. 0204 447 033, 0204 447 033. The number is down below. You can send in all of your messages, your comments, your contributions. So, Doc, you were saying something. You could go ahead.
Exactly.
Yeah.
So then you go on to do the, so we call it palpation.
Okay.
So once you are pressing your breast tissue against the chest wall, then you feel for any abnormal mass.
Okay.
There are some that you may not even have to press. It would have advanced to the extent that it may have become a sore or ulcerated. You get, so you see a big ulcer. Those ones we don't even want to get there because those are some late signs that you can pick up. You get it. So once you press against, you feel that. And then there are times that even just looking at the skin of the breast, you can see some dimpling. It means that there's something that is holding onto the skin.
Okay.
So you may see some dimpling. Other times too, you may have to, or in fact, almost all the time, you would have to express the nipple. So from you see the dark part of the breast, you start from that area, from the circumference of that, you go in both directions, both horizontally and vertically, where you are going to express, okay, and then go that way. One of the signs of breast cancer would be bloody nipple discharge as well. You get it? Yes. So you may end up having some bloody nipple discharge, which is indicative of breast cancer. And mind you, don't forget, another sign could be that you may end up having a swollen upper limb as well. And the reason you may end up having this swelling is that there's a lot of breast tissue, especially from the upper right quadrant, upper outer quadrant. It is actually hidden under the armpits. And then you have something we call lymph nodes there that drain the breast to the armpit or the axilla. So if there's an abnormality there that leads to the blockade of these lymph nodes, you may end up having, maybe somebody may not even have all of these signs that I'm mentioning, but the only thing may be that the whole upper limb would be painful and would be swelling. So once you see that, it is another sign. I did not know that.
So if you have pain up here.
Yes, and then swelling.
And swelling.
Yes, we call it some lymphedema. So in the breast examination, you don't only concentrate on the breast that is on the chest wall. You need to go into your armpits and then also do the massaging or the palpation for any lumps there as well.
So this is for both sexes, if I get you correctly.
Yes.
They're checking.
Exactly.
Wow.
Yes.
Because then, I think a misconception then would have been that it's different the way they check for males.
No,
and
it's same.
for females.
It's the same
for
breast
women,
tissue.
you said 7 days after menstruation.
Yes.
What about for men?
So what I'm going to say is going to also be for people who are menopausal.
Okay.
So when they are menopausal, what you have to do is that just take a particular date within the month So if it is the first day of the month, I would stick to that first day of the month every month, and then I check on that first day. So the same thing with the men as well, especially those who have the family history. They would have to stick to first particular day within the month, and then they stick to that schedule every month. So most of the time we would want to say that for females who are 20 years, you can do the self-breast examination
20 and below, just
20 and above. So you do the breast examination at least once every month, okay, throughout. So at least we expect that by the end of the year, you'd have done about 12 breast examinations. Then those who are 40 and above, you do the breast examination and at least have clinical breast examination done by a doctor once every year. Okay, and then have a mammogram done as well for you once every year. And then this may change depending on your family history. If you have family history of breast cancer or some genetic predisposition, this schedule may change. You may have to start doing the mammograms at an earlier age than what I have mentioned. You get it? So basically, yes, I think we have some pictures here which is showing what I have mentioned already. The lump, you have in the dimpling, you have in the pain, some pain as well. But, and then having some skin changes. So the skin changes can be from color, it's being red, and then you having that peau d'orange or the orange-like skin appearance, and then having the nipple discharges.
I've not really paid attention to someone elaborately explain all of this in the way you've done.
Yeah.
Now, interested. I also reading around cancers, right? You realize that, or I came to the realization that breast cancer is one of the cancers with a lot of misconceptions.
Yeah. True.
For some reason, I'm not too sure what the reasons are.
True.
But the misconceptions about breast cancer were a lot. In the line of your work, what you say are some of the top misconceptions that people
okay
hold?
So one of them is that people tend to say that, okay, once I don't have any family history of breast cancer, it's not for me.
That's a myth.
Yes, it's not for me. But the fact is that even though we see that there is a higher risk of you having breast cancer when you have family history, interestingly, 75% of all breast cancer are sporadic.
That's
no
people
family history.
Without any family history. That's serious.
No family history at all. They're sporadic.
We see.
So once you are female,
yeah,
as we emphasize,
yeah, tricks.
Yeah,
you have
once
to
is
the
the greatest risk factor.
That's what is stuck in my head.
Once you are female, it's the greatest risk factor. Another could be that people think that, oh, once she's been diagnosed with breast cancer, if I share a meal with her in a bowl,
stigma.
I'm going to get it.
Right.
So they stigmatize you. People don't want to share cutleries with you. People don't want to share their bowls with you. In fact, you see a lot of people who may have come in for treatment and then they are now fit and stable to go home, but they break down crying because they know that they are going to be stigmatized once they go home. Nobody wants, especially those who live in compound houses, nobody would want to associate with them. Nobody would want to, because they feel that it's something that they can contract once they come into contact with you.
So the lack of education.
Lack of education.
Creates another problem of stigmatization.
Exactly. Lack of education. And then there are times that people also think that, oh, breast cancer is for the elderly. Yeah. And as I mentioned from our statistics,
the stats is telling a different 30% for 35 and younger.
Exactly.
That's serious.
You get it. So all of these are some of the myths. And then people also think that, okay, once I'm diagnosed with breast cancer, I wouldn't want to have a mastectomy done.
Yeah.
I wouldn't want to have my breast taken out because once I do that, I'm going to die.
Or I'm no longer a woman.
Exactly. Yeah. So
all
like
of these
part of
are
some of, yes. And then I would always want to see that, you need to let people know the education level has actually increased, but we are not there yet. So we need to, so that's why we are all advocates. We need to still drum into people's ears that, breast cancer is real. we can take some precautionary measures. We can make sure that we educate ourselves and we practice how to do our own self-breast examination. And these will go a long way to help us catch some early signs of breast cancer and then give it the necessary attention that it needs.
Oh, it's interesting.
Yeah.
Wow. So for some other people, or sometimes, let me say, when you go to the market, you see our market women also put money in their bra for convenience reasons.
Yeah.
Sometimes even their phones and all of that.
Exactly.
We hear people go around all the time say, oh, it causes breast cancer, that's all of that. Is that also a misconception?
So, yes, it is a misconception in the sense that, well, you putting in money that has gone around would have a lot of microorganisms that can end up giving you some infection if the skin is breached. Okay. But the other thing is that the only thing that is documented is the fact that you haven't had your chest exposed to some radiation puts you
at a
higher risk. So that is what is documented. But as to whether the phones would have setting, that's I can't confirm here. Yes, but the main one that is documented is the fact that if you have had, maybe when you were 10 or within 10 to 30 years, you've had some radiation exposure to the chest region, it puts you at a higher risk.
And it's not also the case that anytime you find a lump in your breast, it is breast cancer.
Exactly. And then the lump is what I am trying to educate people on. Because if you hold the whole breast tissue, will feel like a lump if you hold it like this.
Yeah.
Some of us
if you hold it like this, yes, it all feels lumpy. You're like, so what are they talking about? So as I said, you need to have that. You need to press it against a hard surface. So it has to be between your fingers and then the chest wall. So once you do that and you go in and then you press or you palpate, if there is any lump, an isolated lump, you should be able to pick it up.
Quite recently, social media was rife. I think it was during one of these awareness month creation or awareness month, where we saw a lot of misinformation on social media about how sucking on a breast could cure. They didn't even say reduce the risk, so they said could cure breast cancer, and it went viral, right?
Yeah.
People took it as the gospel. I mean, I saw some doctors come out to put the facts to it, but some people already took it as the truth. So just talk to us about it. What is that thing? Was it a hoax? Was it what was happening?
So it is a misconception. So I'm sure a lot of people, I've seen that as well on social media, where people say that, oh, once you're sucking the breast or sucking on the nipples, it reduces your risk. No, it doesn't.
Not true.
The only thing is that, you see, once you're lactating, it reduces your estrogen, some of your hormones in the body, and that is when you're lactating a baby. Okay, so it reduces some of these hormones.
Lactating an adult.
Exactly. So that is the only thing about it, but not when you have to suck as an adult.
So technically, there's some truth to it.
It depends on in the sense that you're lactating. It's a physiological state.
Okay.
As opposed to you
pleasure
are not.
or for any other
exactly.
thing.
What options are available to someone who has breast cancer?
Okay, so breast cancer, most of the time it depends. Again, once you diagnose or once you have the signs and symptoms, you need to confirm it. And the confirmation would be by you doing a core biopsy. So taking a little bit of it, taking it to the lab, and then looking at it under the microscope, and then that would confirm that, yes, this person has breast cancer. The next stage would be that you would want to do thorough investigations to be sure where it has spread to. Because staging is very important in the treatment of breast cancer. So you need to do some abdominal ultrasounds, you need to do some chest x-rays, and then this would help you know the extent of spread of the breast cancer.
If we're
and
doing
then
an abdominal ultrasound, that means it can spread to the
it can.
abdomen. Okay.
Exactly. It can spread to the abdomen, it can spread to the chest wall, which is, very close, in close proximity to it. Okay, and then once you have you have all of these investigations, you would have to stage it. So stage 1 to 4, and then the earlier stages 1 and 2 are the early stages, and then you have the advanced stages, which are the 3 and then the 4. So the options available for treatment would be either you have surgery done, followed with some chemotherapy or radiation, and then a mixture of these, depending on the stage, whether it's early or late or advanced. You get it. So all of these are available, and you can have just a part of the breast taken away. That's the surgical options, or you can have the whole breast taken away, which is the mastectomy. And mind you, once you've had breast cancer and you have been treated and you are free, puts you at a higher risk of developing breast cancer in the other breast as well. So that is another risk factor you should be looking at. You get it. So all of these are available. So either surgery, chemotherapy, radiation, a combination of any of these, depending on the stage of the cancer.
Wow, interesting.
Are you going to read the question, or should I?
Yeah, go ahead. And
All right. So it says, if a 15-year-old boy gets a lump on the nipple, from the nipple side, and it hurts a little whenever he touches it, and after some years the pain goes away, is that a cause for concern?
So if it is persisting, if the lump is persisting, but I'm suspecting it may have been just some skin infection, maybe a furuncle of some sort that resolved with time. That's what I'm suspecting. But if the lump is still persisting and is really a lump, then you need to have that checked.
15?
Yeah.
That's serious.
Boy. Wow.
Our number again, 0204-447-033, 0204-447-033. Quite a number of questions I have here. So, Doc, this one wants to find out. Okay, so family history, you've touched on it. The contagious one too, you've also touched on that one as well. So he says that please find out from Doc if antiperspirants and deodorants can cause breast cancer.
No, not that has been documented.
But do you get this? Do you get this a lot?
No. What I remember is I think when we were in high school, and then we had this talk about antiperspirants, but nothing related to breast cancer, and I haven't had any patient complain of that.
Talk to us about the science or otherwise of, because I hear some medics advise that, once a while free it, right? The brass.
Free the tatas.
Yeah, is that what they call it?
Yes.
Oh, okay, I didn't know. I didn't know. Yeah, so like Eno is saying, the advice that once a while you do it. Is there science to it, or it is just an awareness creation drive?
It's an awareness creation drive. Yes, basically I think I have seen that on social media as well, where even in some countries where people went a little completely, and then they were marching on the streets. Yes, but it
happens in the
it's
month
their
of
way.
October.
If you thought I was going to cough for that thing,
I was actually waiting.
If you thought I was going to come on that, it's not from my mouth that you hear that. But yeah, I mean, it's I'm sure if that is done, to send a message in a way that no other.
Well, it depends on our traditions,
That's true.
Yeah, so every country and then their way of trying to express, and then
in certain parts of the country, as part of their culture, they free it, right?
Yeah.
During some puberty rights and all of that. So it's not be far away like that. You can get to a point one day where on the Oxford Street. No, I'm not saying it should happen. I'm saying maybe you can get there one day. Okay. So Doc, you're saying it's just for awareness creation?
Yes, it's just for awareness. What I have seen so far is is their way of expressing and then getting people to join in the fight for breast cancer. And then I even saw some time ago where even posters were made all over, like with the bras. People have removed their bras and all of that. Yes, but
very interesting.
Yeah.
So there's nothing harmful with having a bra on 24/7, 7 days a week, 30 days a month, every single time.
Not that I know of, because the only thing is that nobody wears bras for 24/7. Okay.
I wouldn't know
Definitely.
that. I wouldn't know that.
Definitely, when you are going to bed, you would
take it off.
you would take it off.
Yeah.
And the only advice I would have is that we should have them properly cleaned so that you can wear them in a hygienic way.
Okay.
But nobody, I mean, and then you should wear the proper sizes for your breast and all of that. And
You'll be
I think
fine.
you're good to go. Yeah.
Interesting.
Dr. Adams,
Good
thank
to
you so
go.
much for that education. I think
welcome.
so. The advocacy continues.
Definitely.
Keep testing. What do you want to say?
Yeah, we should test. Yeah, we have to test.
Keep testing.